My name is Nthabiseng Sibisi. I'm a professional nurse. I'm also the chairperson of Rural Nursing South Africa. I'd love to share with you my rural journey for a minute. Well, I grew up in rural areas in northern KwaZulu, and I've always been passionate about anything rural healthcare. In terms of patients, what I observed was long distance travel and high transport costs. And that was at the time when the service was still centralized. However, I've seen in the later years that although the services are decentralized, there is still challenges with physical access. What's more interesting was the conversations that I would have with especially women who would come to the ART site, and I saw how the socio-cultural factors affected the community's health-seeking behaviors and treatment adherence, because they would normally start with traditional healers. And that really put me in a position to better appreciate the context within which I was working and to understand individuals, household and communities holistically in order to render better healthcare services. I also saw how the link between migration and HIV, because majority of people in that rural community would actually work in a mining city, and then these were the men who would then come back home, and a lot of times, unfortunately, we would often see women being infected with HIV. On the health systems front, I observed things such as drug stockouts. We observed things such as lack of skill for HIV management. That was back then. And we observed something that has been long standing in healthcare systems: staff shortage and high workload. And I saw how all this would cause stress and burnout among the nurses, who so often never even used their voice. They were so unheard. Their voice was really silent. And I often wondered and questioned why they never speak up. So in the later years, then I went on to enroll for a Master of Public Health with the University of Witwatersrand, where I specialized in rural health. So this degree on its own strategically positioned me to actually be in the forefront of change making for rural populations, because the mandate is all about social justice and health equity. My hopes are that nurses can stand up and use their voices to advocate for their communities and themselves within the healthcare system. Because remember, nurses are the bedrock of the healthcare system. So I wish that all governmental sectors can actually actively collaborate in order to make health service accessible for rural populations. And we can never leave behind traditional leadership, individuals and households, including traditional healers, in decision making about the health service that they want to receive in the rural health space. Last but not least, it would be nice if nurses are celebrated and rewarded from time to time. I'm challenging you, colleagues, to do a similar video to mine and send it to this WhatsApp number 076 555 4711. I repeat, 076 555 4711. So colleagues, with this, I'm welcoming you to the Rural Health Conference, which will be held in Chintsa Town, East London, on 12 to 16 September. You are more than welcome to submit your abstracts for research and quality improvement projects by 12 June 2023. Let's come together and celebrate rural. And if you need any more information, go on to www.ruralhealthconference.org.za. I repeat, www.ruralhealthconference.org.za. Let us go and celebrate rural.